Just about 9 minutes now past 7 o'clock, and heart disease describes a range of conditions that affect your heart. Diseases under the umbrella include coronary artery disease, heart rhythm problems, and congenital heart defects. And it hits us close to home here at Cayman 27, as one of our own is living with a heart disease. You see him on your television every day. He's going to sit down with me. Kevin Watler is here to share his story. We had you on talking about the weather, but we're here to talk about something a lot more serious. Those of us who worked with you, we did not know of your condition. I'm pretty sure you didn't know about it as well. Tell us about the condition that you have, and then we'll get into how you found out.
Okay. Well, I have hypertrophic cardiomyopathy. It's a genetic disorder, so it's not because of the way I eat. It's not the way I got it, but it's something that's in my genetic code, and it's 1 in 500 people have it. I don't know if people remember Jerome Graham. He was a young football player. Mm-hmm. He suddenly died on the football field during a practice. He actually died from this very condition. It's the leading cause of death in young athletes, and it's a very good thing for me that I was not an athletic person growing up. I played a little bit of tennis here and there, a little bit of golf, but more or less, I was not very, very active in that area.
And the thing is, you never knew about it. We worked with you, and then one day you're like, Ben, I have to tell you something. It's about my heart. Bring us to what led you to finding out about this condition?
Yeah, for probably about a year or so before I actually got it checked out, I decided, let me go and find out why my heart at night would hurt, or my chest would hurt. My chest would start to hurt. I'd be sleeping and I would wake up because my heart was just pounding. It was just starting to beat very fast. I really thought it was because I was not a person to go to the gym and work out. I did not necessarily lead the healthiest lifestyle that is recommended by everyone, all the doctors and everything. So I decided to go ahead and get it checked out. And when I went, they did an EKG on me, and the EKG showed an abnormal result. In fact, it was so strange that the doctor said, you know what, it appears that you're having a heart attack right now. And he said, you know what, you need to call your friends, family, tell them that. He said, not even admitting me to the general care at the hospital, he's admitting me to the critical care unit. And I was like, I am a bit in shock.
I remember that morning, because you just told me you were just going to go check the doctor because of a problem you were having, and then you called me and said, oh, they're taking me by ambulance to the cardiac unit. So that was scary for you, your family, and people who know you closely. But good thing for you, most people say, I feel a bit out of shape, let me go gung-ho and get back in shape, hit the gym hard.
And that's the worst thing one can do with this particular condition, because what happens, the heart's too thick. My heart is thicker than the normal heart, and because it's so thick, it cannot pump the way it should. And if the heart's not pumping, your body shuts down and you go in cardiac arrest. So I'm not at high risk for having a heart attack, which is different from cardiac arrest. Mm-hmm. Cardiac arrest is an electrical dysfunction within the heart. If a heart attack is some sort of clogging, and that's usually diet-based. So I did go overseas. I do have an ICD implant, which is a little defibrillator in my chest. So if my heart decides to do something silly, it will take controls of the heart, bring me back to a proper rhythm, and if it does fail, it will shock me back to life just like a pacemaker would.
Wow, talking to a young man, that's really shaking me a bit. And we have footage of you when you went to get all that done. But that's not the only treatment.
That's not. In fact, this summer, I'm going to go and get a cardiac myectomy. Now, that is when they actually do an open heart surgery and shave the heart down to the size it's supposed to be. So,
and so people aren't confused by what they were just seeing, that's some of the stuff you do. We're just seeing bits from the documentary that you did, Matter of the Heart, that April Cummings hosted a few years back. That's one of the things you're doing to help spread awareness. Talk to us about some of the things you're doing.
So I'm also part of the, well, of course, I did that show, A Matter of the Heart. It's available on our website, the Cayman 27 website. Just click on the A Matter of the Heart tab, also on the Cayman Heart Fund's website. And speaking of the Cayman Heart Fund, I'm also part of their membership, where of course, we just had a health screening this past weekend where we're screening people to make sure they are cardiac alert and that sort of stuff, to make sure we are educating the whole entire community on how to lead a healthy life, especially when it comes to your heart. Just like you said earlier on Daybreak this morning, the heart is a very critical organ to have. And without it, there is no life.
There's no life, indeed. And how important is it? Because, especially among men, I always hone in on this. Men are macho, man, I'll be fine. That if you spot something that's not quite normal, that you go get it looked at.
Absolutely. A simple EKG could rule out a lot of things. Speaking with your doctor, explaining what symptoms you're having could sometimes lead to a diagnosis which you may not necessarily like, but at the same time, that same thing may actually save your life later on. So it's very important to know what's going on with your heart, because again, without it, you have no life, and it makes absolutely no sense to live without getting it checked out to make sure you're safe and you have your life.
We'll keep hearing from you, Kevin, and other people this week about the importance of checking your heart and getting everything checked out. Kevin, thank you for sharing your personal story with us. Not many people would be doing that.
No problem.
Thank you very much. And we move along with Daybreak. Remember, if you're listening, watching us, and you're about to head into your car, ICCI FM is where you can find us, 101.1 FM. Daybreak, we'll be right back.